You're watching Reality Check. Tonight we examine the questions surrounding the role of international consulting firms in shaping the Health Ministry's response to the COVID pandemic, particularly the US-based Boston Consulting Group. Now, Boston Consulting Group, by its own website, says that they operate in 90 cities in 50 countries, and they're best known for helping businesses and governments with management solutions. They're part of what is known as the Big Three or Big Four of strategic consulting. But the question really arises, what exactly is their expertise when it comes to healthcare, particularly fighting a public health pandemic? Now, once again, if you look at their website, when it comes to the question of healthcare, it seems to be something that they address largely as an industry, helping healthcare industry with finding solutions, insurance companies, and so on and so forth. But the question of intervening when it comes to a crisis like COVID remains unclear. Now, their role came to light when the Indian government, in response to criticism about how they'd handled the lockdown, put out a series of presentations, projections about how many lives were saved and how many infections were averted because of the lockdown. One of those presentations was by the Boston Consulting Group, and these were all later tweeted out by the Press Information Bureau. Now, in that presentation, the Boston Consulting Group said that India had in fact prevented anywhere between 1 to 2 lakh deaths, which was the highest estimate of all the other presentations that were in a range that was much below the BCG projection. Now, NDTV has learnt that BCG's role is not just limited to making projections, but that in fact they are closely embedded in the Health Ministry's control room. Now, we actually reached out to the Boston Consulting Group for a response, and this is the statement they sent us. They said that we are privileged to work with government stakeholders in COVID scenario mapping, in planning responses, and in analyzing trends, but they cannot comment on specifics. This is the response from the BCG, which we have just put on screen, about exactly what their response has been to this particular question that was raised. We also asked Niti Aayog for a response and the Health Ministry. Niti Aayog said that the BCG is only giving inputs to the empowered group headed by Dr. Vinod Paul. He's not signed with the BCG, and there has been no expenditure whatsoever. This is the response from the Niti Aayog. The Health Ministry has not chosen to respond at all, at least so far. My colleague Arvind Gunasekar joins me. He's been tracking this story, as well as my colleague Malyam Alvi. Let me go across to you, Arvind, first. Now, Arvind, first of all, just to be clear, you reached out both to Niti Aayog and Health Ministry. We saw the Niti Aayog response, but nothing from the Health Ministry yet.
Yeah, so we did reach out to both Niti Aayog and also to the Health Ministry regarding their association with BCG. While Niti Aayog responded in a mail saying that there is no direct association with BCG from Niti Aayog part, but whereas BCG is providing some inputs to an empowered committee that is headed by Niti Aayog member, that is VK Paul. So that was the response we got from Niti Aayog, but whereas the Health Ministry has not yet responded to our query regarding the same.
Okay, but Arvind, you also managed to reach out to a BCG staffer, someone who actually we believe was amongst the team that was at the Health Ministry control room. What did he say to you?
Yeah, so we also spoke to one of the staff member of BCG who is part of the team that is closely associated with the Health Ministry in regarding this handling of COVID-19. So we asked him what kind of service that is being provided by BCG to the Health Ministry for handling COVID-19, and in fact we asked him specifically whether BCG members are very much are present in the war room or the control room of Health Ministry on this, though he didn't deny it, but he refused to comment anything about it, citing the confidentiality clause that has been signed with the client. So he refused to comment anything about it, but also, like I mentioned, he didn't deny it.
Okay, Arvind, thanks very much indeed for that. Now, Maryam, as far as BCG's presentation is concerned, because this is where the questions start arising over the role of these consultancy firms, do they have the expertise to actually make such projections? And also, are these projections, in a sense, conveniently tailored to the government's political imperatives? Now, you actually looked at the numbers about how BCG's estimates were way higher than the others. You also spoke to experts about the credibility of those numbers. What exactly did they tell you?
Exactly. So one thing that jumps right out at us when we look at the BCG's numbers is that it's the most generous of the lot of the other estimates that have been given. According to BCG's numbers, about 1.2 to 2.1 lakh lives were saved because of the lockdown and mitigation measures that were taken, whereas the other estimates, the range is anywhere between 37,000 to 78,000. So in fact, BCG's estimates are almost double what the others have said. So we spoke to experts about this. What do they think about the methodology? Why do they think BCG's estimates are so much higher? Unfortunately, nobody had a very clear answer. They said that the math behind the methodology used by BCG is still unclear. The information that has been shared by the government in that one snippet of a slide that was shared is not enough to let us know how BCG would have arrived at these figures.
All right. Thanks very much indeed for that, Mariam. Okay, before we go to panel, I actually had a chance to speak to Janmajay Sinha, who's the chairman of BCG in India, and I began by asking him exactly what is their role in the health ministry during the pandemic.
So, we never talk about what we are doing with any client anywhere. But in the Ministry of Health, there is a team that they have acknowledged is working. But to be honest, I will not be able to talk about what we are doing there. That the ministry will have to talk itself.
Right. But the point is that you are a management consultancy firm helping with the health crisis. How does that work?
No, we have a big government practice actually. I mean, we work with governments across the world. That's a very large. It's a significant part of our business. We work with the governments in the US, in Australia, in India, in many parts of the world, So that's not, we work with business, we work with government. I mean, we work in the social sector, with many clients. So that is not strictly true. Right. I mean, we work across the ambit.
Sure, you absolutely, Mr. Sinha, there's no doubt that you may be working with governments, but the question is about your expertise in intervening when it comes to a pandemic.
Well, quite frankly, there are different things that we do and there are some things we don't do. We don't claim we are epidemiologists. But we certainly know what a crisis response should be. We work with companies doing that. We work with governments doing that. And some of these are things which require discipline and actually very good consulting skills. Because you need to be able to dimensionalize the problem. You need to have an action agenda. You need to see whether the action is being followed. You need to see whether the dependencies across different wigs are being managed and that there is no loss and gap. So actually it's part of the normal package.
Okay, part of the normal package. Is there a commercial aspect to your involvement with the health ministry?
Look, I have to be honest with you. I can't talk about our engagement. That is just not, we are not allowed to. So I can't. If you were to generically ask me, then I can talk to you. But I mean, we can't talk about specific engagements. It's just we're just not permitted to do that.
Right. I mean, okay, this is a generic question about whether there is a financial aspect. I'm not asking for the specifics of the financials.
So in some places we have been supporting the nation as we must at times like this, where But I don't want to get into the dynamics of what we are doing there. That's not something that we do actually discuss.
Right. But there have been questions about the projections made by the BCG as far as it comes to the kind of averting of deaths and infections during the lockdown, where some experts have questioned whether your projections are realistic.
Yeah, I mean, to be honest with you, the ministry has said it. We could, the John Hopkins had talked about 250 million people getting the virus, I mean, so I didn't see the same amount of challenge coming then. Whenever you will be drawing estimates, and I mean, let me be quite frank here, whenever you are drawing estimates of any kind, you will lay out the assumptions on which you are drawing them. And then if the assumptions are acceptable, then they will lead to a certain outcome. It is not to say that that is the truth or not the truth. That is the best estimate that you can do based on a set of assumptions which are clarified and made clear, and then people accept them or don't. I mean, look, this is the number of unknowns with this is much greater than the number of knowns. So to deal with a crisis like this, you need to be able to take a set of assumptions, and then you have to say, okay, a rigorous and robust model can be run to see that. But I will not comment on that. The ministry can comment on that. They are aware of what it is.
Right. Okay. Just last question, sir, that what would you say to those who raise the question of whether there's a conflict of interest with groups like yours that are both advising and consulting or working with the health ministry, but also with private healthcare providers?
That's a bit laughable, I would say. There is a conflict of interest. There are 20,000 people in BCG who manage their clients. They are often working with clients who are in the same industry. That would be a much, I mean, if any large company will be always dealing with companies who are in the same, so if you're working with two cement companies, would that be a conflict of interest? That would be for one group would be wanting one company to win, the other group would be working with the other company to win, and they would be actually ensuring that they don't share any information from one side to the other. And the fact that, I mean, there is a conflict of interest that there are private companies that we serve and we serve the government, that's a bit laughable. I mean, I would imagine that there would be no service industry then.
All right. Thank you very much indeed, Janmejay Sinha. For that. Okay, joining us tonight on the show, we have with us K. Sujata Rao, who's former Health Secretary, Government of India. We have T. Sundar Raman, he's of Jan Swasthya Abhiyan. He was formerly the Executive Director of the National Health Systems Resource Center under the Health Ministry. And Vivek Reddy, BJP. Thank you all so much for being here. K. Sujata Rao, you heard there Janmejay Sinha's defense of the role of the Boston Consulting Group. But in your time as Health Secretary or even otherwise, has this ever happened that you've had a private consulting group work with the health ministry or be in their control room during a pandemic?
Not at all. Not till I was there till December 2010. We've never allowed any foreign consultants, or even Indian consultancy firms to be there, management consultancies. We've always worked with the WHO. And we've always requested organizations like CDC to come and help us. We've taken help from LSHTM and so on. But neither in HIV/AIDS nor in any of the viral epidemics that we've faced, like H1N1, H5N1, or for that matter, the polio program, did we ever have any such arrangements where our data would be, not handed over, but a consultancy firm like this would be working within the ministry, this control room, and managing it. In fact, I remember once in polio, since the WHO was very keen to eradicate it within the time frame they had set, and our data was showing that polio was still not contained, they removed all the Indians in that monitoring room and brought in Americans and so on from CDC and stuff. And later we objected, saying that should not be done. So this kind of thing also can happen, but we've never had consultancy management firms. This is something so amazing.
Okay, that's amazing. T. Sundaraman, what do you make of it? Because one of the things that appears to be the role of Boston Consulting Group, at least the public aspect of it that we have come across, is the fact that they're doing these projections and numbers and so on and so forth to show that the government may actually have helped avert a big crisis thanks to the lockdown. Now, we heard there Janna Jayasinghe saying that this is just a part of what we do. We do data analysis and so on and so forth. Do you buy that?
I really think there are some serious problems in using such consultancy groups when it comes to public policy. It's all right if it's a company that they are looking at the bottom line. That's a different thing. And if it is a scientific work, there's a greater problem. Let me list them. The first is that any scientific work, and this is eminently a scientific work of making a projection, is scientific only because it admits to being criticized by its peers, by other people who are equally think they can look at the data, they can challenge it, they can discuss it. But when this is all shrouded in a confidentiality clause and nobody can talk about it, at that moment it ceases to be a science in that sense. So in some sense, if they are at the heart of the access to data and their reports that they give are not subject to the same scrutiny that any scientific work has. That's problem number one. Problem number two, you highlighted very well. Though the management was not of the same view, the conflict of interest rises at some point because your major business is from corporate interests. You also work within such an atmosphere and you're influencing public policy by the facts that you make. Whether in this case there is a conflict situation is a different thing. But that is the third real big problem is what we call this client-driven research, where they tend to there are so many assumptions. Then know your business model wants more orders from the client. Then you tend to actually look at those assumptions that are favorable. And finally, accountability. Once they give their report, they are off the scene. And the government is left handling the data.
Okay, so these are the three main concerns that you raised. Vivek Reddy, let me just bring you in. Just to say, though, that it's not just, by the way, Boston Consulting Group. We can actually put that graphic up on the screen. A number of big consultancy firms, whether it's Deloitte, whether it's KPMG, Ernst & Young, Bain, many of them are actually being used by the center as well as by state governments. But they mostly seem to be used for economic reasons, to try and predict the impact of the economic distress of a lockdown, to try and find an exit route for the lockdown and so on and so forth. But Vivek Reddy, it seems to be that when it comes to a healthcare intervention, that is where it seems somewhat unusual to have Boston Consulting Group embedded in the health ministry. What do you make of the questions that have been raised by other panelists who say that this is deeply problematic, that basically you're bringing them in to try and give you data which is friendly to you?
Yes, I think first of all...
which also poses conflicts of interest. Yes.
I think first of all, Vasu, it's good that you have clarified that this has been a practice with other states also. All of these companies or many of these consultants have been contracted by other states apart from the union government. So it is not a singular feature that the union government alone is conducting this activity. So various states are relying upon it. Why are they?
Right.
The economic aspect also is well dealt with because in a looming economic crisis...
Right, but specifically
in a looming economic crisis,
providing
in a looming economic crisis
to the health ministry. Yeah, but Vivek, we're on the point
so
of
far as the
providing intervention
allow me to just complete
ministry on a public health crisis. This is a management consultancy firm. What is their expertise to handle health?
Now, apart from the looming economic crisis and solutions for that crisis and the sorts of stimulus that must be used, what these companies, this is where the two previous speakers have not been able to understand the real significance. What these companies bring into the table is the best global practices. What is the policies of other countries in combating this COVID-19? We are not like in the polio generation, where it takes years for polio to, actually affect. I mean, there is a war on polio.
That does not. Boston Consulting Group has nothing to do with
COVID-19 is such a immediate catastrophe. This immediate catastrophe requires various responses. How do we get the best global practices? The best
Not from
practices
Boston
are brought in by
Consulting.
these companies.
But,
And therefore, apart from BCG, look here again. Mr.
Vivek,
Srinivasan Jain has clarified.
even if it's
Let me just complete.
Vivek, even
Apart
if it's
from-
polio or not
Vasu,
polio,
Vasu, just listen to me.
how does
apart
Boston
from BCG
Consulting
alone-
Group or anybody else help with that?
Vasu, apart from, let me just allow me to complete. Apart from BCG alone, it is not BCG alone and their inputs that we are relying on.
Yeah.
We are relying upon inputs from various other companies throughout the world. And in this modern day, where data is available, you need to crunch this data and scrutinize it. And that is not done, from health perspective alone. You
But
need
we
to
don't
do
have
it from
the
various
expertise.
perspectives
Okay,
in
let's
order
get-
to make the safest possible choices for the government.
Okay,
So
let's get
therefore,
our other panelists.
For example, even White House took the aid and advice of various universities in looking at possible worst scenarios. Why did they do that? White House
Okay,
had so
White
much
House,
of capability, the US government.
White House using universities is different from Boston Consulting Group. But let me just get quickly, others also want to come in. Vivek, do allow me. Yes, Mr. Sundaraman, you were saying something, and then I'll come to Sujata Rao.
So I just don't see what knowledge they bring in about what is happening in other countries. The World Health Organization does a good job of that in transfer.
Well, they have
and
made
there is a
what
weekly.
One at a time.
catastrophe they have made of the world.
Let me just say there is a
Don't forget
weekly
it.
sharing.
They have made a
There
mess
is a
of it.
weekly sharing meeting where they are discussing, the ministers are involved, where they discuss the experiences across the place. There are many scientific channels that are bringing it in, and Boston Consulting Group is not amongst them. So there is that bit is
It is
just
good that,
very unbelievable.
India
So
is
they are-
not relying on
the
WHO
second-
alone.
It's not about
Other countries
WHO
have
alone.
got
There
into
are
a mess.
enough scientific bodies which are doing this work, and BCG is not one of them. That you have to first understand.
Well, it is
that
not BCG alone that we are relying on.
No,
We are
BCG
relying
has
on
nothing to do with that
Please
particular.
don't get fixated.
See,
Okay,
you are-
let's
you
not
are
make
getting-
this
so many
into a
other
fight.
companies.
This is
No, no.
a
They give us
civil,
valuable
this is a
advice.
civil conversation. Vivek, please.
Srinivasan, there
they
is
didn't
one point
interrupt you.
Vivek
Let's
Reddy
not
needs
do
to
interruption.
understand. There's
Okay.
a simple point he needs to understand. I'm not going into the general situation of this. I'm speaking specifically in
Okay,
terms
let's
of
just get-
pandemic management. This particular thing has really the channels through which scientific knowledge is being disseminated, practices are being shared are different. We are in the business, we know where exactly this is, we are in doing this, we know, and it's not this channel. The second
Okay,
thing
just
is
come in,
let's
Vasu?
in
just get
data
Sujata Rao.
crunching,
Yes, sir.
the
If I may
Indian
just get Sujata Rao.
capacity
Yes,
is
Sujata Rao.
much higher
You wanted to
than
come in.
what they can bring in. Our capacity to crunch and analyze data is far superior. At some
Sujata
point,
Rao?
we have enough groups who can
Yeah.
do that.
What
Now,
I
are you
want
able
to
to
say
speak?
is, what I want to
Yes,
say
go ahead.
is that I'm not talking about the use of ENY and BCG for health sector. I mean, supposing I want to set up a hospital, I think they would be the best people to suggest a project report with giving the whole cost-benefit analysis of and cash flow statements and so on, which I don't think our CMO or Chief Medical Officer or DGHS would have. So they have a certain expertise in a certain thing. If I want an HR management plan, maybe BCG would be good. We are not talking about that. What we're talking about is doing modeling. It's a highly sophisticated exercise, which is done essentially by epidemiologists and biostatisticians. Now, the point here is, even if BCG was the main advisor and the ministry takes their estimates and gives it to the world, let me tell you, as an old health person, people will laugh at it because they don't carry any credibility. What we need is credibility. So in HIV/AIDS,
why are so many states
Okay,
relying upon it?
credibility is what we need.
Most
We're out of
states
time.
Because they're following
That's
your
not
bad
correct.
example.
Correct. Most
So
states
that's the
using
problem.
We're out
it.
of time.
You're not able to appreciate.
Okay,
No,
we're
they
out
are
of time.
following your bad
capability
example,
of
sir. You
analyzing
set a bad
it,
example
And
for
you
the
don't
state.
have it, nobody else can provide it.
Okay,
It's very
Vivek, I'll come
sad
back to this.
that
I'll come back to you.
officers are talking
We don't have time for a fresh debate, but credibility, of course, is an important aspect. And also the important question is that we were, I thought, meant to be Atmanirbhar. Why do we need a US-based consultancy to help us in the middle of a pandemic on the healthcare front? But of course, these are questions which we will return to. But for the moment, that's all the time we have. Thank you so much for joining us and for watching Reality Check. Good night.